Hi everyone, my name's Hayley. I'm a support coordinator and a trained counsellor at Ovarian Cancer Australia. We just thought we'd take some time to bring you a little video today about COVID-19 and ovarian cancer and looking after your emotional wellbeing at this time. So what we would say at the moment for anyone who is currently undergoing treatment with ovarian cancer, who has previously had treatment, or anyone who's caring for someone with ovarian cancer, is that this is a time of multiple stresses for you and for your family as well. So you're living with COVID-19 and all of those effects, so self-isolation, there might be financial stresses, you may not have access to all of the treatment that you would usually have access to, and you're going through ovarian cancer treatment as well. So what we're finding, what women are telling us, is that that can equal for them some increased health anxiety. So worry about how your current treatment might be affected, or increased fear of recurrence. So if you've previously had ovarian cancer, increased feelings and worries about your cancer coming back and what that might look like if there's also a public health crisis happening at the same time. Women are also talking about changes to their mood, so low mood or just feeling really emotionally up and down as well. They're also talking to us about how their coping strategies are reduced, so things they would usually use to help them, such as catching up with friends and family, anything you can do outside of the house is not currently open to them, and that's difficult. And then women are also telling us about practical barriers to medical and psychological treatment as well. So all of those responses are really understandable and really natural at this time of so much uncertainty. So that's the first thing to say, is that that's a really normal and valid response to what's happening at the moment, all of those things. But what we wanted to do today is maybe just provide you with a few tools to help coping and to really bear this time, which is quite difficult for quite a lot of people. So one of the responses you might be having is that increased feeling of anxiety. So we're seeing all of this content on our news, on our social media, about hospitals, about the health system, and it can really get us thinking about how our previous treatment was, about what our current treatment might look like, and it can really start some of those spiraling thoughts and worries about the future. So I think one of the first things to think about is, how do I actually get the information I need from my medical team, and would that help my current thinking about the situation? So you may need to ask your doctor questions about what would happen if there was to continue to be a health crisis and I need treatment, or what's going to happen with my current treatment. And that can help us to sort of put some of our mind at ease about the care that we're receiving. But we all know that sometimes, even with all the information in the world, we can still find ourselves sort of falling into that trap, really, of that self-talk around worrying about something that may happen in the future that we don't yet have any control over. So first, I think it's really important just to monitor when that's happening for us. So are we going into that rumination where we're trying to solve problems? Are we thinking in really black and white terms? If I do go out to that appointment, I will definitely get COVID, and I will definitely have a really bad response and get really, really ill. That it can be that really black and white thinking. So really monitoring when that's happening and when that's causing distress. And can we just practice some really good self-talk towards ourselves? Can we say, okay, I'm really worried about going to that appointment, but I have had a chat to my doctor and he is considering whether he might be able to do a phone appointment with me. If he can't, maybe what I will do is make sure that I know the COVID policy at the hospital, that I'm practicing really good hand hygiene, and then I will have done everything I can to protect myself at this time. Again, though, sometimes even checking in with that self-talk doesn't really provide the circuit breaker that we need when we're really anxious. So then I talk about, what can we do to calm the body? what can we do to calm the body for enough time that our mind sort of comes back online and can be helpful to us when our thoughts are racing? So that might be just focusing on our breathing, really carefully focusing on really deep and long breaths. It may be looking out the window and looking at the trees we can see, the plants we can see, the birds that we can see outside, or even taking that walk outside and really noticing the outside world. Or it might just be doing the next practical thing. So, okay, I had decided I was going to have lunch at 12, so I'm going to do that. I'm going to be really mindful about the way that I'm preparing everything. I'm going to really notice everything that I'm doing, and doing that to help you bring yourself back online. You can do it as well with a cup of tea, really choosing your favourite mug, choosing your tea, smelling the tea, tasting the tea, and that can all really ground us and calm ourselves and bring us back into the current moment, which can really help when our thoughts feel a bit out of control. And also just consider if you find that the news or social media is really making you more anxious, consider limiting that exposure you're having. Do you need to just maybe watch the half-hour news update, or just read the headlines to keep up to date, but not sort of add some fuel to those really anxious thoughts? So the other thing I often talk about at this time is self-compassion and self-care. So how can we relate to ourselves with warmth and forgiveness at this time? It's really easy to get into our inner critic and to think about, I'm doing this wrong, I should be doing something differently. But I think it's really important at this time to just treat ourselves with the loving, gentle care we would a best friend or a beloved family member. And we can really enact this attitude of self-compassion by practicing self-care. So ask yourself, during an average day, what are the things that really nourish me or sustain me or recharge me? Now, it might be a time when we have to reframe some of that. So it can't be the going to have coffee with a friend. So maybe it's exploring some new technologies and doing a FaceTime with a friend. We may not be able to get to that yoga class that we love, but can we find a video online where we can practice at home? So really being creative and really monitoring ourselves to figure out what helps us at these times of distress, of low mood, of anxiety. So if you're comfortable, what I will do now is just do a small self-compassion meditation, which you can listen to. And this is something that you can do yourself at any time during the day. So if you're comfortable, just close your eyes. And when you're ready, just bring to mind a time when you have felt anxiety or distress or a really low mood about the current situation. Really visualize that situation. And now when you're ready, just say to yourself, this is a moment of suffering. This is really understandable for me to feel this at the moment because it's a really difficult time. So just acknowledge it and say it's there. Don't try to push it away. And then try and say to yourself, suffering is a part of life. It's a really hard part of life, but it is a part of life that many people experience. And when you're ready, just put your hands over your heart. Feel the warmth of your hands on your chest and some gentle pressure as well. And really notice your chest rhythmically rising and falling beneath your hands as you breathe. Now say to yourself, may I be kind to myself. May I accept myself just as I am. Maybe play around with a few other sentences about self-kindness as well. It could be, may I forgive myself. May I safely endure this pain. May I find peace in my heart. May I protect myself May I learn to live with ease and well-being. May we learn to live together in peace. When you're ready, just open your eyes again and really notice how you feel. And that little practice is really easy just to take into your everyday. When we need a break, can we stop and practice that self-compassion? The other thing to remember is that Ovarian Cancer Australia is absolutely still here to help at this time. All of our support groups are currently offered either online or via phone. We have an amazing online forum called OCA Connect, where you can really check in with other women and say, well, how are you coping at this time? What's helped for you? We have some great online written resources, and I draw your attention especially to the Fear of Recurrence booklet. So that's the fear we were talking about earlier that can really come up at a time when we're thinking about health a lot, is the distress about cancer coming back or worsening. And that booklet is really helpful for some strategies to cope with that. We have a whole lot of webinars online as well on our website, where you can watch health professionals speak about different aspects of ovarian cancer, including the emotional effect. And of course, you can call our support line and get some assistance from our nurses and other health professionals, or just chat through what's happening for you at the moment. You can also consider the TIL support program, which is regular ongoing support from a cancer nurse who will support you, but also have contact with your medical team and really ensure you're getting a really high quality of care during the treatment. So please don't hesitate to contact us. You can email us, that's on the screen at the moment. You can go to the website, or you can call 1300 660 334.